they end up seeing other people as threats. They end up perpetuating oppression or being silent in the face of oppression. And they also have a hard time having empathy and compassion for other people's emotions as well as their own emotions. And so this is a mindset that harms all of us, white people and people from the global majority like us. It harms us all.
And so what you have just described, however, seems to be the way of the world. Hello, everyone, and welcome to Dream Leapers. I'm your host, Harriette Cole, and I have a very special guest today, someone I have gotten to know over a period of time because we've been doing some work together. He is someone who has definitely opened my eyes to such a unique intersection of health, equity, and culture. He is Dr. Jonathan Lassiter, a clinical psychologist, professor, author, and founder of Lassiter Health in New York City, where he specializes in culturally informed psychotherapy for high-achieving professionals, creatives, LGBTQ plus individuals, and people living with chronic illness. His research focuses on African-centered psychology, intersectionality, and resilience within Black and LGBTQ plus communities. His mission is rooted in a simple but profound belief. When we honor all parts of who we are, we heal. Dr. Lassiter is a powerful storyteller, and this month he will be releasing his book, How I Know White People Are Crazy and Other Stories, Notes from a Frustrated Black Psychologist. This book challenges narratives about race and health in America with sharp insight, humor, and heart. Lassiter is also the co-editor of the award-winning text, Black LGBT Health in the United States, the intersection of race, gender, and sexual orientation. He's been featured in Forbes, NBC, PBS, iHeart Radio, and more. Today, Dr. Lassiter tells us what it means to really show up as your full self, how culture shapes our mental well-being, and why liberation begins from within. Please join me in welcoming Dr. Jonathan Lassiter. Hi there.
Hello, thank you so much for having me. I'm so excited.
I'm excited too. We have been talking about this book for a while, and now it's fully cooked. It's here. So I have to start with the title because, why white? What is the title? How I know.
How I Know White People Are Crazy and Other Stories. Notes from a Frustrated Black Psychologist.
So, when you tell people this title, they're like, what?
Yeah, they definitely do. I always say it depends because some people are like, what? And then some people are like, yeah.
So what does it mean? Because obviously you named it this to get a reaction out of people. Why did you give it this name? And what do you mean by How I Know White People Are Crazy?
Yes, so you're 100% right. I did name it so that it gets attention. I want this book to get a lot of attention because I think there are some very powerful ideas in here about mental health, about African-centered psychology, about the personal story and holistic healing that we have not heard or we don't have much exposure to. So I wanted to make sure that it got people's attention so that they will engage with the ideas in the book. That title, though, comes from two particular experiences. One is my father. Growing up, he would train these young white men at the pest control company he worked for. And then his supervisor would promote the young white men over him, even though my father had more experience and would be a better supervisor for the company. And so my dad would come home and he would say, boy, these white people are crazy. And so that stuck with me. As I became an adult, I started to have my own experiences with racism and heterosexism, and particularly one story that I write about in the book is about experiencing failing the diversity project on my internship in Indianapolis. And I too said at that point, these white people are crazy. And
So
so
what does
that's
that
where
mean? What happened? Give us the insight into what happened that triggered that thought.
Yes. So I'll give you the Cliff Notes version of the story.
Okay.
I detail it in the book though. So imagine young Black man. He's been in school for 5 years. He has one more year to go before he graduates and becomes a doctor. So that 1 year, I'm working in a hospital from 9 to 5, and I'm seeing clients. And I'm also being trained in all of these different therapy methods. And during one of the training sessions, my supervisors, 2 white women, say to me and my other cohort members, 2 other white women, hey, we really value diversity. So we want you all to do a project where you put yourself in a situation where you are a minority for 2 hours. And so I, as a Black, same gender loving man with a chronic illness, I'm like, that's called my life. What should I do? And so they decide that I should be a minority in a different way. And that different way they decided was because I don't like sports, I should go attend a sporting event. So long story short, I go, I do that. And then I come back and I tell them about it and they say, yeah, we don't think you really got the experience of being a minority. And so in that moment, I'm saying, what? You're telling a Black, same gender loving man with sickle cell anemia he doesn't understand what it's like to be a minority? And again, that's at that point I said, these white people are crazy.
Well, understood. Under very good examples. And there are plenty of white folks who will say, I'm not crazy. I don't know what you're talking about. That you're not talking about me. In your book, because obviously you are a professional. This is the trigger to get people to think about this topic, but you put forth something that you call the whiteness mindset, which really relates to more than just white people. Can you tell us what does the whiteness mindset mean, and how does this, in a more serious way, kind of relate to your thinking and your study and the way that you approach psychology?
Yes. So the whiteness mindset is a mental health problem that I'm putting forward that we should think about in a more formal way. We have African-centered psychologists like Dr. Linda James Myers, Dr. Kobe Cabone, who have written about these sorts of things that I put forth in the book. However, it has not been adopted broadly. And so what I'm trying to do is to present it in a more formal way, and hopefully we'll look at it more broadly. And so the whiteness mindset assumes 3 things. And so it assumes that there's not enough to go around, kill or be killed, and us versus them, or divide and conquer, right? And what happens when people live their life in a way in which they believe these assumptions are true, then they value materialism, individualism, and competition. And therefore, they end up seeing other people as threats. They end up perpetuating oppression or being silent in the face of oppression. And they also have a hard time having empathy and compassion for other people's emotions as well as their own emotions. And so this is a mindset that harms all of us, white people and people from the global majority like us. It harms us all.
And so what you have just described, however, seems to be the way of the world. I mean, people believe that in a world of tremendous competition, that I need to win over you, and especially when we think about people of color, Black people in particular, we've often been taught that there can only be one, especially if you decide to work in corporate America, that there's room for one. And so I might have to elbow you out of the way in order to get that one space. I mean, that has been a mindset for a long time as this country has, skyrocketed. Given that that is the way many think, I'm going to believe that a lot of people would say, well, what are you talking about? That's how it is, Dr. Lassiter.
Yeah, and to that I say that may be the way it is. However, that has not been the way it always was. There was a much healthier way of being before we have the domination of this European whiteness mindset that does inform all of our systems today. And people think that's the way it is today. And again, it may be in some settings. And though I encourage you to look at what are the outcomes of it being the way that it is. We have so many people who are on antidepressants and other psychotropic medications because they are just trying to cope with oppression, and it manifests as depression and anxiety. Right? We have people, again, who are fighting against their own interests because that's just the way it is. And so what I'm trying to do in the book is inform people about African-centered psychology and different ways of thinking about mental health that predate colonialism and a European way of understanding that focuses on individualism, competition, and materialism, because we do know that that was a way that existed in pre-colonial societies. And I think there's much we can learn today from those societies.
So before we go into that, I want to delve a little deeper because you mentioned a couple of things. You mentioned depression and some mental illness that people are having, and that seems to be on the rise. And honestly, on the rise in all communities, especially young people these days. You also mentioned, I think in the book, about substance abuse and how that is on the rise. Can you just delve a little deeper into the negative impact that this whiteness mindset is having on society right now?
Yeah, so there definitely are rises in certain mental health problems that we see. So we know that there is a rise in suicide among young, adolescent, emerging adult Black Americans. And that is really remarkable given that Black Americans as a whole have had some of the lowest suicide rates traditionally. One of the things that I personally think accounts for that is this whiteness mindset that divides and conquers and is causing people to be disconnected from parts of themselves. And one of those important parts is spirituality. Research has shown that spirituality was often a protective factor for a lot of mental health outcomes, including suicide, for Black Americans. But now we're seeing, with the erosion of that and the increase in the whiteness mindset, those things like suicide are starting to skyrocket again. And of course, we have substance use, people trying to cope every day. Those numbers are also significant. And then we all know about the opioid epidemic, which is having a real toll on Black and brown communities as well as white communities. And again, what is opioid use besides trying to cope with a distressing world? And so we see that these mental health problems, whether it's suicide, whether it's substance use, and again, I mentioned depression earlier, they're all having a very negative effect on all of us. Why? Because the way of the world is structured by this whiteness mindset.
And so when we think about the world in which we live today, and one of the other factors that I think a lot of people talk about that's relatively new influence, which is social media. You know, that social media, many people on social media are projecting the best life. You know, I'm doing this, I'm doing that. My life is fabulous. And it creates that FOMO, fear of missing out, for so many people. And this sense of my life is greater than your life. My life is perfect. And, you know, people looking at that may feel less than. What impact does social media have through this whiteness mindset?
So again, social media really is really promotes this divide and conquer mentality because people see themselves as in competition. They see themselves they're comparing themselves to what they see on social media. And again, as you said, social media, it's all about presenting the best versions of ourselves. And even sometimes you may see some people like, oh, I'm really sad today. Even that's curated. And so there is this sense that we are comparing ourselves to people. There is this sense of missing out, and we're being exposed to a whole bunch of bad news all the time too. So that definitely contributes to poor mental health.
Wow. Hey guys, this is Dream Leapers with Harriette Cole. We are talking with Dr. Jonathan Lassiter, some serious stuff, talking about mental health and the way that people kind of the mindset that governs many people in this country in contemporary society, and how it can be unhealthy for a lot of folks. So, Dr. Lassiter, you have espoused that there's another way of looking at the world. And I just want to look, when we think about your education as we lead up to this, because you are professionally trained, you have a doctorate in psychology, but as you have written in your book and you and I have discussed in the past, you needed to go beyond the traditional study, which is significant years of study to understand contemporary psychology, in order to find a way to help heal your patients, because what you had discovered through traditional psychology was not enough. So can you frame, what would traditional Western psychology be, and why wasn't it enough?
Yes. So I used to be on faculty, so I used to train psychology students, right? And so one of the things that I would always tell them when I would introduce them to African-centered psychology, I would say, you're going to learn a different type of psychology. I know that you think all psychology is the same, but what you really have been learning is Eurocentric psychology. And what we mean by that is that Eurocentric psychology is psychology based on the ideas of predominantly white, heterosexual, cisgender men from Europe. So we're talking Freud, we're talking Carl Jung, we're talking B.F. Skinner, all of these pioneers in psychology. And they have an understanding of psychology as this very narrow thing. It's the study of mind and behavior, and it's very individualistic. If we think about European philosophers like Rene Descartes, he talked about, I think, therefore I am. And so therefore he put what it meant to be a human being into this individualistic perspective. But there is a psychology that predates all of that from the African continent, based in African ways of understanding life. And so from that, we get something like Ubuntu, which means a person is a person through other people, or I am because we are. And that's the South African principle. So identity is not individual, but it's collective. And so African-centered psychology really focuses in on how spirituality, community, and collective self-identity can help us with our mental health. And though, to your point, I had to do my own research to learn that, because again, I was learning all of these white theorists. And what I found when I was doing the work, particularly with communities from the global majority, is that these theories weren't really working for them. So I had to go and mine my own culture and look at the work of Black psychologists before me to find better tools for the communities that I serve.
And so let's look at something you just mentioned, Descartes. I think, therefore I am, and then Ubuntu, which is more. What is Ubuntu say?
Ubuntu is a person through other people, right? And so it means,
so that's community, where I think community. Therefore I am is completely individualistic, right? Mm-hmm. And so these are very different ways of looking at the world. One being it's all about me. One being existence is based upon community. So this is probably considered revolutionary, because at least for today. Now you're saying that this predates European psychology, but today it's all about, like I said, elbowing and how can I get to the top, and way even before a corporate job, just even in school, how, the percentage points that to get to the tippy top of a class, how you get to be valedictorian, how you get to be whatever those points are, which I certainly grew up. My father was valedictorian at his college at Morgan State, and I wanted to be valedictorian like him, and I didn't quite make it, but I tried. That was the goal, was to excellence. Was like, in my family, excellence was the only option. That's what we were taught. So what does excellence mean from an African mindset?
Yes, and thank you so much for asking that question. Excellence from an African mindset is not just, again, about individual achievement, but it's about who am I to my community. So like you too, I grew up like, I got to make all A's. I got to make the A+. Right. The dean's list, all this stuff. However, the more that I started to learn about African-centered psychology, the more I started to try to live that myself, it became less about me being at the top and more about how do I give back to my community? How do I use all of this education? How do I use all of this perspective, all of this training to help my community? Again, a person is a person through other persons, right? And so who I am is based on my contributions to others, right? And so I think when we talk about excellence, we're looking at how do we contribute to others and not just achieve individually.
My favorite author in this space, thinker in this space, is Malidoma Somé, who wrote this book called Of Water and the Spirit. And he was a highly educated, through European education system, person who was from a small village in Burkina Faso. And I remember in this book, he talks about the role of community. And he even talks about, like, everybody in the community is valuable. The people who are disabled have a special value. The people who are, however different they might be, are valued and sometimes considered closer to God than just the average citizen. So every single person has a value. And he said that it was incumbent upon the community to keep the soil moist, to keep fertile soil so that every single person in the community could develop their gifts. And if everybody develops their gifts, then you have a healthy community. I always have appreciated that sentiment, which is very different from, the kill or be killed sentiment that you are calling the whiteness mindset. You talk about the principles of Ma'at as another example of African cultures telling you what to live by. Can you explain that in this context?
Yes. So the principles of Ma'at, again, is a different way of living that predates our understanding of Eurocentric mental health. And so the principles of Ma'at are based in Egyptian philosophies. And so it's 7 different principles, and those are order, balance, harmony, propriety, justice, truth, and reciprocity. And so those are principles that this Egyptian philosophy says that when we live by those principles, we become more aligned with our true spiritual selves. We become more aligned with our community, and we can live healthier lives. And so those principles are principles that we can live individually. How are we treating ourselves with justice? Are we telling the truth about ourselves? We all are talking to ourselves throughout the day. What are we saying to ourselves? Are we saying things that are going to create balance and harmony, or are we saying things to ourselves that create discord? And also, how are we using these principles in our relationships with others?
So could you give us an example of what that might look like in everyday life?
Yeah. So, for instance, if we think about the principle of order, right? So the principle of Ma'at, when we think about order, what we're talking about is being free of clutter, mentally, spiritually, etc., right? And being focused on the present moment, our centering our consciousness. And so you mentioned the scrolling earlier and this FOMO. So when we are not centered, when we are not present, then we can fall into things like doom scrolling, right? And then again, our minds start to race. So many of my clients are like, oh, I see this bad news, and then my mind starts to go down this rabbit hole. And so the principle of Ma'at, particularly order for this example, is something that we could think about, like, how do we create order in our life? And particularly when it comes to social media, one of the things that I work with my clients with is, okay, if you're going to do social media, then how can you also integrate good news and not just bad news into your feed? And maybe you are only looking at social media for an hour a day and then put it away. Therefore, again, you can be more in the present moment and you can get rid of some of that clutter in your mind.
How do you help someone heal who may be suffering from, let's give an example. Right now, we know that 300,000 plus Black women lost their jobs. This was before the government shutdown.
Yeah.
Now we have the government shutdown that is disproportionately hit people of color who often work for the government. And just in general, the economy, some people say it's doing well, but for a lot of people, it is not. When you're in a position where you have lost your job, or your job is uncertain, or you are underemployed in terms of how much money you make, regardless of how much work you do, that is a real stress. That is real. That is tangible. That is immediately impacting whether you can put food on the table or not. How can you use African-centered philosophy to be like a lifeline when you are living in kill or be killed? You are living in us against them, and you're not winning.
So again, I would challenge people to think beyond us versus them, kill or be killed. Because if we have that mentality, let's say we're really struggling, and I've definitely been in struggle mode before, right? Like when I was in graduate school, I was living off the bare minimum. So I know what that life is like. And so, however, though, if I was like in kill or be kill mode, us versus them mode, then I would have been trying to figure out solutions for myself. And so I would have either succeeded or perished by myself. However, what if we start to think more collectively, think more about mutual aid? So who are the people in my community that I can maybe barter with? Maybe I have sugar and they have bread, right? How can we do these things on a very real level? And also to think about how, maybe we are eating at this person's house one day and then we're eating at another person's house the other day. So there's much more ways that we can succeed together than if we're trying to do it on our own. And African-centered psychology has always bared that out. And I think it still has relevance for today.
As you say that, it just takes me right to my grandmother. And I think to so many people. So my grandmother was a domestic worker. She worked until she was 93 as a domestic worker. And I remember the stories, and then even seeing for myself, there was always enough food. If somebody else came to the house and didn't have anything to eat, she would stretch that food and there would be enough for the person who came knocking on the door. This is part of Black culture in America, especially, let's say, working class Black culture. And I'm wondering does the shift occur sometimes when people get more wealth? That with more wealth, does there come this sense of this is mine and not yours? I'm just curious. Have you seen that?
I definitely see that. Again, in my private practice, I'm often working with high achieving people from racial ethnic backgrounds. And basically, when I say high achieving, these are people with like well-paying jobs, right? And so they definitely are in this wealthy category. And what part of what happens in order to be in that space, it requires if not giving up one's culture, definitely a code switching. And so this whiteness mindset becomes even more ingrained the closer we get to that proximity of whiteness, which sometimes comes with those financial benefits, right? And so I definitely do see a correlation there. I wouldn't necessarily say that's the only reason that happens, but I definitely see a correlation that as people get more resources, they start to take on a more of a whiteness mindset. I definitely see that.
And so this notion of the whiteness mindset, you write in your book that it's not just white people who have it, that maybe everybody has it in American culture right now. What do you mean by that?
So what I mean by that is the whiteness mindset is a way of thinking. Therefore, it's not limited to just a person of a particular race or ethnicity or cultural background. It is something that we can all have and be infected by. And I think that we are, particularly in the United States, because we're all socialized in a white supremacist, heterosexist, ableist world. And so we're always thinking about who are these people? How are they different from me? Competition, materialism, individualism. That's just ingrained in our society. And so the whiteness mindset happens in all of us. It just looks different depending on what community we're in.
Hey guys, this is Dream Leapers with Harriette Cole. We are having a very deep conversation with Dr. Jonathan Lassiter, who is the author of the new book, How I Know White People Are Crazy and Other Stories, Notes from a Frustrated Black Psychologist. I think of white folks in my world, friends, who will push back hard. Well, I am not racist. I do not agree with you putting this on my shoulders. I'm not that person. What do you say to folks who have that reaction?
Well, one, I hope you're not. Right? So that's number one. Because again, the whiteness mindset is in us all. And I think about it on a continuum from mild to moderate to severe levels of the whiteness mindset operating in us. So maybe some people do have mild levels of the whiteness mindset. So one, I hope you are. But two, I also encourage people to really look deeply at how they think about the world. Who are they in community with? How do they think about even the notion of community, mutual aid, and collective identity? So we all, again, are exposed to white supremacy, heterosexism, ableism, all of these isms that come out of the whiteness mindset. So it's very hard for us not to have ingested that in some way. So keep your eye out. I would just say be aware. Even if you think you don't have it, really do some self-reflection, because I'm sure it's there. It's still in me. So And I write about it. I've been working to minimize it for years, but there's still a portion in me, right? That materialism thing is very strong because I grew up, not having enough, right? Very literally. And so I have to make sure that I don't get to a place where I'm putting my worth on how much money I have or how fancy of a vacation I can take. So we all have to do the work continuously.
So go back to people in corporate America, because that's like a very structured way of thinking and living and working, and a way of building wealth, which many people have built wealth through jobs in corporate America. If that is where you are, I think of people who are, climbing that ladder, and now we're saying, well, maybe your approach is not right. How can you stay in your job and potentially be healthier, adopt some of these African-centered ways of thinking, and continue to succeed? Is it possible to have both?
I think it's possible. I do think, though, that the more we work towards minimizing the whiteness mindset, I do think our values will change. So I'm not suggesting that people give up their jobs. However, through my work, I have seen that more people do start to question the systems that they find themselves in, the more they do the work of minimizing the whiteness mindset. But for those people who are in those positions that you mentioned, I always say, hey, listen, a both and perspective can really help. So yeah, you may need to go to your job and you may need to be competitive, etc. And you do that at your job. However, you also make sure that you are not basing your identity on that job, right? So how are you engaging with your culture? How are you engaging with your community? How are you using the benefits of your job to also help your community as well? So we can both excel in these systems that are informed by the whiteness mindset, but we have to make sure that they don't become the core of who we know ourselves to be, and make sure that that's always grounded in our African-centered culture. And then we could take the resources from that place and redirect them so that we can be more communal, we can be and we can be healthier. Yes.
So I'm curious, a lot of people today, a lot more people today engage therapists than ever. When I was growing up, it was considered a stigma. And now, I have a 21-year-old daughter. I feel like most kids in that age group are willing, if they need it, there's no stigma. They're willing to go and get support. And lots of people do. The people who are coming to you, what would you say are some of the top mental health challenges that they have, and what kind of solutions are you offering to them?
Yeah. So a lot of my clients are coming to with me suffering from severe anxiety, a lot of hyper criticism of themselves. They are suffering from depression. I have a lot of clients who are also coping with trauma as well as discrimination in their jobs. And also that discrimination contributes to depression and anxiety as well. And so what I'm doing with a lot of my clients is I am looking both at that sort of micro level individual sources of anxiety and depression. So what are they telling themselves? Like, again, how do we talk to ourselves? The way that we talk to ourselves influences our mood a lot, right? And so I'm looking at that sort of micro level, what's going through your brain. I'm also looking at the societal level. And so that's where I take this sort of anti-oppressive lens in my work that says that our mental health is not just about who we are at an individual level, but it's also about the society around us and how we function and how we cope with that society. So for instance, some of my clients are coming in and they are experiencing racism or sexism at their job, and they're blaming themselves like, oh, maybe I'm too sensitive, maybe I'm reading into that. And part of my work as the therapist is to say, no, let's really look at this, right? You are not imagining that. You are not imagining that. This really is happening, and this is about them more than it's about you. So how do we change the narrative so that you're not blaming yourself, you're not internalizing the sickness of a society?
And so step one, I guess, is recognize it's not you. You can reject internalizing it, but then what? Because if it's part of the system and they fully believe whatever it is that they've told themselves about you, and some of those stereotypes, the angry Black woman, that's just one of the biggest ones that comes up so often, but, the inept Black man, whatever these things are, how do you break through the stereotype in order to be seen for who you are?
Yeah. So that's another thing that we work on. So one, it is about, again, changing that narrative for themselves, right? And two, it's also about acceptance that other people may not ever see you the way that you want them to see you. So letting go of that desire, that impulse to disprove a stereotype. I help my clients just be them, be in the present moment, be authentic. So it becomes more about how do you live in your authenticity versus trying to prove or disprove something to someone who doesn't respect you anyway.
Okay, so that feels like the breaking point because on the one hand, you can fight. You can fight, you can get a lawyer and fight against discrimination. You can fight the system. And certainly fighting the system has been something that we have been doing since the beginning of time. Certainly those fights have mattered. Civil rights fights have mattered, moving all the way up until this moment. And at the same time, it takes a lot of energy to fight. And is the fight always worth it? What is your thinking around that fight?
So I say choose your battle wisely. So fighting can look like a lot of different things. Fighting isn't always going out into the street and protesting. Fighting isn't necessarily suing anyone. Fighting isn't necessarily calling out your superiors every time they commit a microaggression. Sometimes fighting, again, looks like shielding yourself. A lot of what I work with my clients with is how do you inoculate yourself so that you sort of, have this force field around you so that whatever comes to you, it's not about you. And so you don't take it personally, right? So fighting can look like that. Fighting can also look like, okay, so I may have to put up with this BS while I'm at work, but what am I doing outside of that space, right? And how do I then show up authentically? And how do I connect with others? And that's what fighting can look like. For me, I always said my fighting looked like the teaching that I did, the mentoring that I did with my students. So fighting can look a lot of different ways.
So there's something that is known as post-traumatic slave disorder, I believe. Can you tell us what that is, who came up with it, and what that means?
Yeah, so post-traumatic slave syndrome is a disorder that was coined and defined by Dr. Joy DeGruy, who is a doctor who has a doctorate in social work research. And she says that it is a disorder that affects people of African descent, and it is because of their history of slavery. And so she says it's three main symptoms. Those symptoms are ever-present anger, vacant esteem, and racist socialization. So ever-present anger is this sense of anger and rage bubbling up under the surface because of continuously having your goals denied, right? You're working towards something and the door is shut every time you feel like you're getting close. Vacant esteem is when you have very low self-esteem because you've been told all these Black stereotypes, like you said, angry Black woman and a Black man, and so people start to feel, I've had some people say, I hate being Black, I hate being Asian, I hate being Indian. And I'm like, no, again, there's nothing wrong with your culture. The problem is the systems of oppression, right? But that's an example of vacant esteem when people hate their own culture. And then there's racist socialization, and that's when people not only believe those negative things about their culture, but they also pass them on. And so Dr. Joy DeGruy says that this is a serious mental health problem, and often it's intergenerational, and it has effects across generations. And I've seen that in my own family, and I write about it in the book about how that happened to my father, this sort of racist socialization, and he definitely had an ever-present anger, and how he passed that down to my brother and I in the form of emotional suppression. And so that is definitely a form of intergenerational trauma.
So here's a bit of pushback. There are plenty of people who say you are, kind of leaning on the shield of something that was 400 years ago. You stop blaming your situation on something that is so so far away. In the same breath, there are white folks who say, I don't have anything to do with slavery. I didn't do that. My parents didn't do that. Don't blame that on me. You know, this sense of don't blame on me something that I didn't do, even if a few generations back, it may have been your ancestors. Similarly, don't claim it if, you know, this is 2025. Why are you trying to put something off on something 400 years ago? What do you have to say to that?
So again, to me, anyone that says that is embodying and displaying symptoms of the whiteness mindset, right? Mm-hmm. Because again, they are fragmenting themselves. And what I mean by that is that they are disconnecting themselves from their culture, from their history. And so whether it is white people saying, I don't have anything to do with this because my ancestors, or maybe not my ancestors, but other people did this. Again, that is individualism. Mm-hmm. And so, no, the same way you benefit from these things, you are also responsible for these things. And when I hear Black people say that, I get really sad because there's so much power in knowing our history. I always used to get called the nerd, and I will never let that bother me because I knew Black history. I knew that W.E.B. Du Bois existed. I knew that Benjamin Banneker existed. So I think there's a lot of mental health benefits of connecting to something, even if it was 400 years ago.
Touche on that point, you guys. Hey, this is Dream Leapers with Harriette Cole. We got just a few minutes left. The time goes by so fast. We are talking with Dr. Lassiter, who is the author of How I Know White People Are Crazy and Other Stories, Notes from a Frustrated Black Psychologist. So, Dr. Lassiter, when we think about moving forward, you know, what do you hope people will gain from your book? And what tools do you think they can use in order to be happier, to be healthier, to not feel that they need to drug themselves, drown themselves, or anything else in order to find some happiness?
Yes. So I'll answer that first question. So what I want people to get from this book is three things. One is that I want them to understand that what they think they know about psychology and mental health is very narrow, and that it is really based on the ideas of a small group of white European men from the 17th, 1800s. And so it's very narrow. Two, I want them to understand that there is a different understanding of psychology that predates that small group of white men, and that we can all learn from that and to live healthier lives, more expansive lives than the narrowness of that Eurocentric psychology. And three, I want people to understand the whiteness mindset that I've talked about before. And I guess I'll add a fourth one, and that is I want people to really connect with the stories. The book is structured telling stories as well as a lot of insights into mental health. But the stories have a lot of emotions in them. There's, as you talked about before, humor, there's sadness, there's happiness. So I want people to connect with all of those.
And just in terms of tools that people can use on the day-to-day, you know, when this is a time of struggle for a lot of people. I mean, it absolutely is. And also even this time of year, even if it weren't this year, when we move into the holidays, a lot of people have challenges. What do you as a psychologist suggest for folks who are moving into this end of year where there's a lot of uncertainty and a lot of emotion?
Yes. So again, I go back to those principles about art, and particularly I'm thinking about balance and I'm thinking about harmony. So when we think about balance, we are looking at how do we have a both and perspective? How do we balance all the things in our life so that we're not necessarily neglecting either part? So yeah, you have to show up for work, but how are you also replenishing yourself? And how do you set those boundaries? So maybe you don't want to go to the holiday party. Maybe you don't want to go to that family event. You are allowed to set boundaries for yourself. And also thinking about harmony. Who in your community do you vibe with? And again, how can you connect with them so that you pour into them and they are also pouring into you. So thinking about, again, where is your source of care coming from? And again, setting those boundaries is something that I work with my clients with, particularly around this time of year.
And who are some of the scholars who you have studied from the Afrocentric mindset? Because you mentioned these ancient practices like Ma'at, but there are a number of scholars who you mentioned in your book and who you have a lot of respect for. Who are some of those people?
Yes, so one, I would say my number one on my Mount Rushmore is Dr. Linda James Myers, and she is a psychologist who in the 80s and 90s really put forth this idea of the optimal worldview, and she compares that to the suboptimal worldview. And she says that, again, the suboptimal worldview is based on competition, materialism, individualism. A lot of what I'm calling the whiteness mindset was inspired by her work. And so Dr. Lyndon James Myers is one of them. Dr. Wade Nobles is another one of them. And he has been very influential in my thinking about intellectual colonialism and how, again, these white mindsets, this white way of understanding what it means to be human has been put atop all other ways. And that's the only thing we really learn in our psychology education, and he calls that intellectual intellectual colonialism. And then I also think about someone like Dr. Colby Cabone, who put forth this idea of cultural misorientation, and he talked about how Black people are culturally misoriented when they let go of or deny their African-centered values, again, those things from 400 years ago, in order to become more like their white counterparts. Because again, whiteness is not serving white people.
There's the rub, right? Thank you, Dr. Lassiter. Congratulations on your new book. You gave us a lot to think about. Thank you so much.
Thank you so much for having me.
And thank you to all of you for tuning in. I hope you enjoyed this conversation with Dr. Jonathan Lassiter. His book is How I Know White People Are Crazy and Other Stories, Notes from a Frustrated Black Psychologist. It's just out right now. Fascinating. And as he mentioned, there are lots of personal stories throughout the book to give you examples and insights into how he has come to this way of thinking. Until next time, have a great day and make it count.